Hello and welcome to Total Health. I'm your host, Dr. Derek De Silva. A recent study by the American Academy of Pediatrics is an eye-opener for parents. It revealed young athletes are experiencing more and more serious knee injuries, most notably ACL and meniscus tears. Since 1999, ACL tears have risen 11% per year. Here to talk about prevention, treatment, and long-term effects is Dr. Joseph Jimenez, an orthopedist and founding partner of Performance Spine and Sports Medicine in Lawrenceville. Welcome to the program.
Thank you for having me.
We all hear the term ACL, meniscus tears. Can we just go over a little bit of anatomy? We've got a graphic of this, and if you can just talk to us and explain this graphic to us, it would be great.
Absolutely. The picture that you're showing actually has the meniscus label on the outside of the knee, and the ACL is labeled as such. So injuries happen.
And the patella is the kneecap, right? Just
patella is the kneecap, yes. Right. So injuries happen when something like this occurs. The knee buckles inward. So inward in this diagram is the knee buckling in toward the right side of your screen, because the forces are coming from the outside, which is on the left side of the screen. And not only is it buckling inward, it's also twisting. So it's twisting outward. And
so it's a twisting, it's a rotation, and a buckling, which produces all of the tears.
Absolutely. It tears the ACL, and it also impacts the meniscus, or the cartilage. That's the cushion between your thigh bone and your leg bone.
Now, you know, the knee is such a relatively unstable joint, isn't it? I mean, given
Absolutely.
the forces, given trauma that can be done to that area, it is very unstable.
It is unstable, but we have a lot of mechanisms that help us. All the ligaments, from the ACL to the PCL, and the medial collateral ligaments and lateral collateral ligaments, the muscles and the hips, as well as, believe it or not, your ankle stability has much to do with stabilizing your knee as well.
So, wait, say that again. Your ankle stability has to do with your knee stability?
Yes, it turns out if you tend to roll in or out your ankle, for instance.
You mean when you're walking? When
you're walking, the knee tends to buckle very subtly, buckles either to the left, into your midline of your body, or outward. So it starts many times at the ankle. So,
you know, I mentioned in the introduction the amount of injuries are going up. Why? I mean, it seems obvious to me, but I'm going to ask you the question. Why are there so many more injuries today?
The biggest reason is going to be the concept of what's called exposure hours. Younger people are getting into sports, and more specialized sports, and that participation alone, the number of hours spent in the gym or in the field, is what is predisposing our athletes to injury.
You know, I see a lot of professional athletes today wearing the big knee braces even though they don't have an injury. And is that, I mean, it's these, quite honestly, I have one of these babies, and I wear one of these things. Is this something that we can use as prevention, or is this a treatment modality?
Right now, all the studies show that there is no evidence that it prevents injury. However, there is tons of evidence that if I put a knee brace on your knee, it changes how your muscles react. So it might actually have a detrimental effect if you use it for preventive purposes.
Now, you have this really cool performance 3D technology, which we're going to, oh, here we go.
Yes.
Tell us what's going on here.
Sure. So at our clinic in Lawrenceville and Newtown, we do a simple analysis. Running, we saw a previous shot of walking, running. You're going to see a shot of the overhead squat in a second. But what we do is we put on sensors all over the body, and we create a three-dimensional image of what is going on at the major joints, especially at the hip, knee, and ankle.
Okay.
And we can expose various weaknesses, various muscle groups that need stretching, that need strengthening, and whether or not you need more balance training.
Now, wait a minute, you can see the skeleton. Is that her actual skeleton?
Yes, so what happens is the software translates your motion into a 3D image, and we use a skeleton as a way of illustrating these joints in motion.
So what is the purpose of this? What are you trying to achieve here?
Sure. So in the vertical jump and the overhead squat, we can tell you any patient, if they're weak at the ankles, if their knee tends to buckle inward, which is one of the single most important things to look at when you're looking at biomechanic analysis, and if they have hip issues that actually impact their knee mechanics. So we can see all of that in 3D motion analysis.
And then you can modify movements, you can modify treatments and therapies based on what you see in that.
Yes. So we translate these sensors, whatever it's picked up, the data that's picked up, into muscle groups. Basically, is it your hamstrings? Is it your quads? Is it your hip or core? And then tailor your program based on what's weak or what's tight.
Wonderful. Thank you for joining us.
Thank you for having me.
Later in the show, how to enjoy dining out without overdoing it. And after the break, a look at the alternative therapy of reflexology. What exactly is it, and is it right for you? But first, your health bite of the week. Here's some natural remedies to relieve sinus pain and pressure. Welcome back to 12 to Health. I'm Dr. Derek Da Silva. Can applying pressure to one's hands and feet actually help the body heal and relax? Well, those who practice the alternative therapy known as reflexology say yes. Here to show us what's involved with this therapy and if reflexology may be right for you is Desiree Watson, reflexologist and owner of the Wellness Lounge in South Orange. And we also have Shannon, who has volunteered to be our patient today. Welcome to both of you.
Thank you.
Let me tell you something here. I am really upset with you that you didn't use me as your patient today. That's number one, because I love this stuff. Absolutely love it. What is reflexology?
Reflexology is a applied therapy which one reflexologist will use the thumb or the fingers to apply pressure on the nerve endings in the feet. You have more nerves in your feet than any other part of your body, and it relaxes you.
So how do we know, this is a treatment therapy that has been done for 5,000 years in China, 3,000, 4,000 years in India. Do we know how it works?
Yes. It works by applying the pressure on the feet, and it inflicts the nerves so that all of your major organs will relax and de-stress.
Now, is this similar to acupuncture, acupressure, where you hit certain points, if you will? Is this similar?
It's similar, although acupressure and acupuncture are much more alike. Reflexology, we work on the hands and the feet. Acupressure and acupuncture, you use your fingertips or needles to apply the pressure to the various parts of the body.
Who's your typical patient?
Anyone who wants to relax. Anyone who wants to relax. But we do get a number of patients or clients in that have some issues, health issues, and we normally relax them and recommend them to a physician.
What kind of health issues are you talking about here?
We could have a patient come in with feet that are really very large and may be related to an illness, diabetes, and we recommend them to physicians, but we will relax them and try and get rid of some of that fluid.
Some of the things that I have seen and I have read on reflexology, some of the studies have been for people that have high blood pressure,
yes,
people that have eating disorders, people that have that are very stressed, right? I mean, how does that work? Are you comfortable talking about the science of that?
I am. Well, in your feet here, I could actually show you where your brain, your sinuses, your eyes, and your ears are affected. When we apply pressure, you can actually relax. So, of course, if you have high blood pressure, as you mentioned, I would like initially to start working on the spinal area here.
Right.
To relax the spine, because the spine is pressed toward all the major organs. So I can show you where your lung, your heart is. So we begin by going across this way to relax the lung, the heart, and all the major organs, and we relax the spine area, relax the brain.
Neat. Now we can also do this on the hands, right?
We can.
Can we have Shannon, sit up and we'll do the hand thing.
Yes.
Also, this can be done on the earlobes.
It can be done on
Right.
the earlobes and the hands.
Okay.
And what's great about it, if you attend a number of workshops, you can actually do this at home on family and friends. And I actually encourage it because it's very relaxing. And again, you can apply pressure in certain areas that will affect the major organs in a positive way, in a relaxing way. So here's your brain on your thumb.
Right.
Shannon was actually
Shannon's
having
got a good
headache.
brain. I think
Yes,
Shannon
she does.
has a good brain. Okay.
Pre-med here. She was having a headache earlier, and you can apply pressure here on the big thumb.
Okay.
And on the toe, it's the big toe. And we have so many sinus problems now.
All right. And tell me a little
pressure
bit
here.
about your place. Is the Wellness Lounge in
It
Orange?
is. The Wellness Lounge, we offer various workshops and seminars with amazing professionals who are trained and experienced and certified in their areas of reflexology, acupuncture, bioidentical hormone treatment, all sorts of amazing
So it's a
therapies.
one-stop cool place to go.
It is. We even do classes in sustainability, upcycling, and recycling.
Very good, very good. So, do you feel good?
Yeah, very
Do you love
relaxed. Love it.
How often do you do this, by the way? Do you do it?
I haven't done it recently, but I'm definitely gonna go.
You need to get back on there.
Place. Yeah.
Very good. Hey, thank you both for being here. It's been a pleasure to have you with us. Thank
Thank
you.
you.
Still to come, how dining out doesn't have to take a toll on your waistline. But first, here's a look at this week's Community Health Calendar.
Here.
Welcome back. We all love to dine out at least once in a while, but doing so can be hazardous to our waistlines. Portion control is key to losing and maintaining a healthy weight, but it's much harder to do at restaurants than in your own home. Here with advice on how to dine out successfully is the co-author of the book, Turbocharged: Accelerate Your Fat-Burning Metabolism, Get Lean Fast, and Leave Diet and Exercise Rules in the Dust. I'd like to welcome Diane Griselle. Thank you so much for joining us.
Thank you for having me.
I love that last part, and leave diet and exercise rules in the dust. What do you mean by that?
Who wouldn't like to drive around in a Ferrari, a Maserati, a Lamborghini, a Porsche? But the fact is, we're driving around every day in a vehicle that's millions of times more superior.
So the body is this incredible machine that I don't think people have any clue as to how complex and how involved it really is, do they?
We really don't have any idea. That's why the goal is always to keep it simple with everything we do with our bodies.
What do you think one of the most important things that we need to be concerned about when we're eating out is?
Well, to number one, understand that the portions the restaurants are serving these days are to get you back in there, but there's tons of filler in. They're making them bigger, but not necessarily more nutritious.
Should we avoid these restaurants that have these monster portions?
Absolutely not. There's many things you can do. You can share the meal, or you can prepare to take some home, and maybe it's a meal for 2 or 3 days thereafter.
And tips. I mean, I love tips, and I love that when people bring us tips. The first tip we have is skip the appetizers, bread, and chips. That is so obvious, isn't it?
That really is. And those are the filler foods. And that's where restaurants are grabbing us all now. They're filling us up with carbohydrates that are very nutritionally empty. And that just doesn't help in any kind of meal or a healthy body.
You know, I'll tell you what I have started to do. When I go to a restaurant, I tell them not to put bread on the table.
That's great.
Because when you put that bread on the table, there's no way that you're going to resist that bread, right?
Exactly. Who can resist warm bread? Get it away.
Get it out of the table. Eat only, the next one you have is eat only half your meal and take the other half home.
Yes. You know, taking a portion home is great. You might find somebody on the street who needs it, you know, right outside the restaurant, or it may be your meal for the next day. Could be lunch, could be dinner, or it doesn't need, you know, sometimes people are reluctant to leave a little, and so they fill up. It can be a portion of the meal the next day. It doesn't have to be a whole meal.
True. Split the entree.
Absolutely. When you're there with kids, especially, it's an easy way. It's sometimes a fun way just to enjoy a meal. You can get an entree and a great appetizer and split it, or 2 appetizers and 1 good entree and split it.
Yeah, that's what I was going to say. That's the other thing that I've done very frequently is just get 2 appetizers and skip the entree.
Absolutely.
It's cheaper that way too.
Much.
It really is.
Occasionally a restaurant has a charge for splitting, but it's still less than the meal. And the bottom line is, what doesn't go to waste often ends up on our wastes.
Exactly.
Good one to keep in mind.
Try dining family style. What do you mean by that?
If there are 5 of you, try ordering 3 entrees and splitting them between the 3 of you. And then maybe get 2 appetizers or get some good sides to go with it. But you don't necessarily need 1 full entree per person.
Right, and that leads us to the next one, which you said, make substitutions or order healthy sides.
That's an important one, you know, and when you order those healthy sides, whether you say you want a salad on the side or vegetables on the side, you also want to think of those sides without the heavy sauces. If you want butter on your broccoli, fine. Ask for it plain and ask for butter on the side. Then you can control a little more.
The butter and also the salad dressings, right? That's another big one that is loaded with calories.
It's not just loaded with calories, it's loaded with preservatives and different chemicals that really just bloat us and make us feel crappy.
Yeah. Next one, I think the last one we have here is frequent restaurants that are accommodating. Accommodating to our what?
Accommodating to our preference to ask for a smaller portion, or ask for the sauce on the side, or ask for a different side than maybe they're serving. If the main dish comes with pasta, is it okay at that restaurant to get a vegetable instead?
Why did you write this book?
We bought this book because we believe the human body is the most amazing thing in the world. We believe people are getting heavier, and it's not for lack of willpower, it's because of poor information.
Do you think that people are also confused today as to what to do and what not to do?
Very, very confused because there's such conflicting advice. Is it high calories? Is it low calories? Is it high protein? Is it low protein? Is it high carb, low carb? We basically tell everyone, throw all the rules out. Pretend you have try to make your slate as clean as possible. And we narrowed it down to then 7 other steps. Very simple ones.
And those are all the steps that you go through in your book. Common sense. By looking through this, they're all common sense.
Very common sense.
Thank you for joining us.
Thank you very much.
If you have any questions about anything you've seen on our show today, email them to us at 12toyourhealth@news12.com. Thanks for watching 12 to Your Health. And until next time, I'm Dr. Derek De Silva, and may you always be blessed with good health.